Unfortunately, we're not doing that well, particularly for MDG5, for maternal mortality. We've had large advances for child mortality. In fact, child mortality has gone down quite substantially. But for maternal mortality, it's still quite high, unacceptably high.
Even before Yolanda, our maternal mortality rate is not as good as we would like it to be. In fact, we belong to the lower third of the implementers of the program.
There are high maternal deaths in that area, high neonatal deaths, and even infant deaths. And there is very low facility-based deliveries and not so low but not also high skilled birth attendance. Even the nutrition status of children in Eastern Visayas is poor.
This is made worse, actually, with Yolanda. When all the facilities are destroyed, the equipment also damaged, and personnel also being dislocated in a way to a certain extent because the health providers themselves were victims of that.
To be honest, there is no formal statistics, only anecdotal. So I think that is one other part where we have to do something. Data collection in the Philippines is so poor.
The Ateneo School of Medicine and Public Health is a 7-year-old school. Its purpose is to develop doctors for the future, which means doctors who are adept at their clinical skills, but also quite skilled in addressing the issues of public health in this country. The Ateneo Center for Health Evidence, Action and Leadership, or AHEALS, is actually a center composed of the 8 schools of the Ateneo de Manila. The 4 Loyola schools, the School of Humanities, Social Sciences, Science and Engineering, and Management. And the 4 professional schools, Law, Business, Government, and Medicine and Public Health. The purpose of this center is actually to develop a multidisciplinary approach to action research for the many public health problems of the country.
The first project of the center is entitled Assessing Access to Prenatal Delivery and Postpartum Services in Eastern Visayas region, Philippines.
The project will run for about 6 months altogether. We started training in August, but we hope to complete all of this plus the analysis by February or March.
The objective of this research is to put into proper scientific perspective the situation or the health status in Region 8.
To understand the factors surrounding access to health services, specifically health services surrounding prenatal care, delivery, and postpartum services or services after a mother has given birth.
So those things, we would like to really see if it will be confirmed by this study, by this research. And what else are the gaps?
Well, there are 3 organizations involved: the Department of Health, the Ateneo School of Medicine and Public Health, and AHEALS, and the World Health Organization. Well, the Ateneo essentially does the research, it conceptualizes the research, working with both Department of Health and World Health Organization. The Department of Health provides, you might say, the support as well as the access to the different health centers and the different local governments of the Eastern Visayas region. And WHO provides technical guidance as well as financial support for getting this project completed. The Eastern Visayas region is one of the poorest regions in the country, and we wanted to be able to assess how maternal care was actually being provided there, as well as how maternal care was affected by Yolanda. Well, we know that in Eastern Visayas, the services for maternal care are poor, and that results in many women as well as children or their babies dying from this lack of services. Well, mothers and children are a very vulnerable group, and there's high morbidity and mortality there. And it's a priority, it's a global priority. We're trying to find out the answers to our questions through a household survey, where we are going to 3,200 households in the Eastern Visayas to interview these women about how they access maternal care services before, during, and after their pregnancy.
Our sampling methodology ensures that there's proper representation of all 6 provinces in the Eastern Visayas region. And within these provinces, there's also representation of the GIDA areas.
GIDA areas are geographically isolated and disadvantaged areas, which means far-flung, isolated, depressed areas that were just relatively out of the way. Transportation is more expensive because very few businesses actually ply the route. Gasoline costs are more expensive. It takes more time to travel there. And so you don't have the infrastructure support in the GIDA areas. For, let's say, maternal care, we had 2 categories. We selected barangays from the GIDA areas, we selected from the non-GIDA areas, so that eventually our sample contained barangays from both areas to be able to ensure that we could analyze differences between the 2 of them. So it was multi-stage sampling. We first had to select the different barangays. And then from the barangays, we had to randomize women which we were going to visit so that we could make inferences for the population of Eastern Visayas. This survey, this household survey, will validate some of the data that is being collected because it will be more precise because we are actually getting it from the women who actually experienced the lack of maternal care services. Another unique feature of this is we're using GPS technology. The field workers go to these houses, actually record the GPS coordinates, and we are able to track where actually the interviews were being conducted.
Using this device, they will get the location, the geographic location of the facility, capture that in a particular form. Once they have the complete list of the women that are eligible for the interview, they will then move to each of the households where they will again use the GPS device, and this time they will locate the household itself, and this information is captured into the questionnaire as well. On a daily basis almost, and when they have access to internet, what the data collector is using in capturing this information into Google Drive, where we will be able to see that directly on the map, almost live.
Well, the questionnaire that we have now is 16 pages long, which includes English text and a text of the local dialect, either Waray or Cebuano.
And therefore, careful and patient conduct of the interview was crucial.
The focus of the study is really access. So we broke down the factors to access, to influencing access into 3 major components. These are physical factors, economic factors, and sociocultural factors.
Distance, travel, transport, those are the physical factors. There are economic factors, expenses, affordability, and then of course there are social factors, cultural factors that will either facilitate or obstruct women going and looking for these services. The field personnel are young and I'd say quite highly motivated nurses. They are all residents of Eastern Visayas. They were actually selected quite carefully. These field personnel are responsible for going there, interviewing, documenting the interview and the responses. being able to provide the GPS coordinates, as well as safeguarding the data once collected. It's also their responsibility, of course, to relate properly with the family, with the respondents, provide a measure of compassion in the conduct of the interview. And of course, in a sense, they are messengers of hope because by being present in these households during the interview, they communicate the message that somebody cares or the government cares for these people.
Mahirap yung travel. Meron kasi yung early in the morning, 3 a.m. kailangan mong gumising para makasabay ka dun sa sasakyan. Kasi yung isang biyahe lang siya sa isang araw.
Well, the field interviewers have to go out. They have to travel to these places. Once they arrive there, they have to, of course, pay their respects to maybe the political authorities there.
When they get to the health facility, they are supposed to acquire the target client list or TCL for prenatal care. From this TCL, they will randomly select mothers. Once a list of 30 randomly selected women is completed per barangay, the field personnel coordinate with the barangay health workers to accompany them as they visit the homes of these women.
Once they do that, they have to find the household. And then once they've found the household, they have to identify the proper respondent. Once they've identified the proper respondent, they have to find out if that respondent is willing to be interviewed. Maybe permission might be needed from the husband or from the mother, and so on and so forth. And then they have to go through this long questionnaire and ensure that the respondent is actually still enthusiastic about answering the questions and continuing to actually provide the information. So there are very, very many challenges in completing this data collection. So it's a long process in which we have to ensure that the data is properly collected as well as properly analyzed. It's important to have the support of all of these personnel, the barangay health workers or BHWs, the midwives, the municipal health officers, the nurses, because they provide the infrastructure and administrative support for maternal care in the region.
Yung work na to para sa akin napaka-special kasi masaya ako na kahit sa konting effort ko, nakatulong ako sa research na to.
The results here in Region 8 may be beneficial to other regions as well. So the potential impact of that in itself is exciting enough. And it's a privilege to see that everyone has one mission to really improve the health and improve the lives of Filipinos.
This is an honest-to-goodness expression of the truth in the field regarding health services. We may not be able to respond appropriately that which is not real and being presented realistically.
Because what we were having were only anecdotal, most of it were anecdotal, that mothers are dying, neonates are dying because of this and that reason. This research will validate all these anecdotes, and so that we can come up with sustainable interventions that will really work there, so that we will improve the state of maternal and child health, not only in the Visayas, but in the Philippines.
I think the ultimate significance of this research project is that our nurses, our field personnel, actually were able to reach these very, very remote barangays, find these women, shake their hands, ask them questions, give them a token gift. All of these actions summing up to the message that we care for them and that we're trying to find ways of improving services for them.